So I became involved with KCA quite early on, at the end of my fellowship, because my mentor at that time, Bernard Escudier, was one of the Europe experts in this field. He used to attend the KCA conferences. And this is where I started to come to the conference, both in Europe as well as in the US. At that time it was in Chicago. And it was the opportunity to have great educational content over RCC on a short time frame, like 2 days overview of everything that is going on in treatment and research with RCC. That was the educational part. But it was also the aspect of connecting to a community, and KCA was the opportunity to network with all the experts in the field of renal cell carcinoma. And the third aspect that came quite promptly as well was the opportunity to broadcast my own research, offering a stage to present the data that we had generated in our country, in our institution. So it was education, network, and broadcasting the work. And the next step of my involvement to the KCA were first the fact that KCA triggered their think tank, so basically small format of discussion on what's the unmet need in RCC research. That started quite early on for me. And then taking part in planning the activities, the educational activities of the KCA with regard to the European conference, the International European Conference that is taking place every year in Europe at spring. And so I was asked to take part in the scientific committee, in the planning committee for a couple of years. And then on a regular basis, I attended the conference as a speaker. And a few years down the line, I was then asked to join the board of the KCA, board of directors. It was, to me, something extremely humbling, given that I'm European, as you can get from my accent, and not based in the US. But it was also highlighting the fact that KCA really wanted to have a worldwide touch and have more feedback from people attending outside of the US. So I was pleased to be part of the MSC, the Medical Steering Committee of the KCA first, then Board of Directors, and bringing this international flavor to the discussion.
So I was thinking about how I got involved with KCA, and I'm pretty sure I might be one of the oldest members here. My first KCA was when I was a fellow at University of Chicago. It was in the Palmer House Hilton. Pretty sure it was 1999, if I'm remembering correctly. It was maybe the first KCA or the second, I don't quite remember, but it was definitely early days. And in those days, they only had one every other year because there really wasn't anything to talk about. And you know, I've probably come every year ever since, right? And then it became annual at some point, and up until this year, of course. So, you know, it's always been the premier clinical meeting, you know, and I think that's the bread and butter of the KCA and the IKCS Symposium, is that it's, you know, it's a clinical meeting to come learn about the clinical care of patients, the latest clinical data. And they've certainly done translational sessions and other things sort of around the edges, but I think of it as sort of a clinical meeting that's sort of grown over the years sort of to, you know, and as we've had more drugs and more data, obviously the meeting has become, you know, again, just this powerhouse of a clinical meeting.